Hello, this is Jessica Crudup. Welcome to the Jessica Crudup Show. Today is September the 7th, 2021. Yes, it is what it is, ladies and gentlemen. Boy, oh boy, what a day it was. I gotta tell you, had a nice time. We're here to talk about, we're here to talk about the coronavirus once again. The COVID-19 once again. Now it says, now we're going to take a look now this week. The COVID-19 risk for vaccinated people is roughly equal to riding in a vehicle, which the data suggests. So here's what they were talking about here. It says the odds of vaccinated person getting sick with COVID-19 has changed since the more transmissible Delta variant came to dominate the U.S. pandemic, but probably not as much as you think. David Leonhardt writes in today's New York Times in July the Centers for Disease Control and Prevention report that terrifying fact that vaccinated people with the Delta variant of the COVID-19 virus carry roughly the same viral load in their noses and throats as unvaccinated people. But newer data is suggesting that the true picture is less alarming. Stats from Utah, Virginia, and Kings County, Seattle, Washington, three areas that reported detailed data on COVID-19 infections by vaccination status, are consistent with the idea that about 1 in 5,000 vaccinated Americans had tested positive for COVID each day in which rates, Leonhardt writes, and are in areas like Seattle, with high vaccination rates, social distancing, and mass users. The odds are probably less than 1 in 10,000. The risks aren't zero, as Answers Flash notes. In 1 in 5,000 risks every day works out to about a 7% per year. Chances of getting sick from COVID-19 and Leonhardt weighs off the undiagnosed breakthrough cases because there are often so many that people do not know them and do not pass the virus to anyone else. But the reality is that the risk of getting any version of the virus remains small for the vaccinated, and the risk of getting badly sick remains most minuscule. Leonhardt writes, in Seattle, on an average of risk day, about 1 hour every 1 million vaccinated residents have been immobilized to the hospital with COVID symptoms. That risk is so close to zero that the human mind can't easily process it. My best attempt is to say that the COVID-19 risks for most vaccinated people are in the same order of magnitude as risks that people unthinkingly accept every day, like riding in a vehicle. You can read Leonhardt's entire case and his explanation about why vulnerable low can end up being invalid if we vaccinated. That's for the New York Times. And yes, it is. For real. And take a look at this. Look at this. This is for the Fox News. What the Fox News ever covered on that one? Now, Sean Brown in Kentucky says newly public documents reveal the history of the U.S. finding of coronavirus resource in one. So that's what happens. This is what's happened since before. We didn't want to. We don't want to go to Fox News and all this kind of stuff, all this kind of mess. Okay, we're just gonna skip it there. Okay. That's because they're doing their job. So we're going to skip it down. Yes, now, COVID-19 live updates. There's a resource highlights and continues. We're going to skip it down, and that's okay. This is what's going to happen here, folks. If this wasp don't get this out of here. There you go. Now here's what we might say about the coronavirus. Here's what we might say about this. Now, about the COVID-19. Now, what we know about the impact of COVID-19 for the fall. So this is what they're talking about here. And we go to ABC News about this. That COVID-19 could be in the fall for sure. Here's what he had to say.
To get to. And we're talking COVID, so yes, you said the season's changed. We're going into fall. We thought this would be a fall, that everything would be opened up, but in respect to COVID, what are we looking like going into the fall?
Well, I think this is a good time to take stock of where we've been and then where we may be going. So let's look back, if you will, and look at least the summer of COVID and what it's done for us and where we are in this pandemic. First of all, in terms of testing, good news. Obviously, we have better access and better turnaround time, so that's improving. In terms of prevention, we're hearing more about these so-called NPIs, these non-pharmaceutical interventions, things like mask wearing, distancing, ventilation. They were important in the beginning. They're still important now. Vaccines, yes, we have several that are authorized. We have at least one that's approved. We have others in clinical trials for babies starting at age 6 months of age. So that is ongoing. And then treatments, lots of improvements in this area. Outpatient antibody cocktail being used more and more, and inpatient clinical care of those patients hospitalized definitely improved.
Yeah, I mean, we accomplished a lot this summer, and now we're all looking and wondering and, concerned. What is the fall? What is the winter going to look like?
Well, you've heard me say it before, and while everyone likes to make forecasts and look at these prediction models, no one has a crystal ball. There are more questions and variables here at this point, but things that we don't know the impact of for this fall and winter season. How indoor gatherings will affect the pandemic rates. Will influenza or flu be a player this year? It wasn't last year, thank goodness, but we don't know about this season. We have to see how the in-person school attendance pans out in terms of transmission, both for students and faculty and adults. And then we have to keep a close eye, as always, on our hospitals, on our healthcare system, that many of which are at or over capacity. And we will be looking at that as we look at all these elements throughout the winter.
So that's what they're talking about. Thank you, ABC News. And it's just like this. And it's just like what is going to happen when we get to fall. Okay? What will happen when we get to fall? It's going to hit this fall. I believe it is. But that doesn't mean we're going to see this one happening again. Maybe. So, it is what it is. And just like this, we can see this fall what's happening. And this is going to be interesting. Very interesting. So, we might be seeing the fall and the winter and what it's going to look like. What the fall season look like. And that's exactly what happened here. And it's just like this. And what things going to look like when it's head to fall. The fall starts on September 20th. Sometimes it will happen, and sometimes it can turn. The school's back in. Last day was Labor Day, no school. Today the school was back in. He knows. Just like it's yesterday, it's just like this. It's just like it's always been, always will be. So, We're gonna find out what happens. For sure. This is what it's all about here up there in North Carolina, so what's happening. Now, CDC adds 2 popular island gateways to very high COVID-19 travel risk list. It says for this one, it says the CDC's environment list of travel nodes ranges from level 1 low and to level 4 very high. Destinations that fall into the COVID-19 very high level 4 category have had more than 500 cases per 100,000 residents in the past 28 days, according to CDC Kaplan. The level 3 category applies to destinations that have between 100 and 500 cases per 100,000 residents in the past 28 days. Jamaica's COVID-19 vaccinations campaign has had low numbers so far, with only 19 doses given per 100 people as of Tuesday. It has been in a series of curfews since late August, with no movement, days in hopes of showing the virus spread. Several Lincolns has seen a swell in cases recently despite having one of Asia's strongest vaccination campaigns, where 102 doses are administered per 100 people as of Tuesday. By comparison, its most long-lost neighbor India has only given 49 doses per 100 people. Now, the same thing can happen as it can happen when people get vaccinated up there outside of the United States. That's what happened. Okay, we're gonna go. Biden survives severely aftermath in New York and New Jersey. And here's what's happening here, folks. Now, President Biden called on the need to start adapting the country's influence to climate change after torrential damage caused by wilderness or Hurricane Ida in the Northeast. I think we are all seeing, even the climate skeptics are seeing, that this really does matter. And it's not just whether or not people who are trying to get by in these homes, in these alleys, here working their butts off do well. It's people in the hotels along the shore will find that as this rain and all that this change takes place in the groundwater, the buildings are absolutely being to tip. 100-story buildings. This goes so far beyond what anybody is willing to speak to up to now. Biden said during this remarks from Queens, New York, Biden discussing the damage he saw in both New York and New Jersey caused by the storm, and the impact it had our communities. Walking these neighborhoods, meeting the families and the first response, seeing how folks are doing after this destruction and pain, and another destination storm is an eye-opener. The people who stand on the other side of the fences who don't live there, who are yelling that we are talking about, and we're refreshing over free enterprise by doing something about climate change. They don't live there. They don't live there. They don't understand, the president said. Biden urges people to start thinking the threat of climate change seriously and listen to the experts who said this is a cold wave situation. Now take a look at this. Well, here's what Biden said. Climate change poses an estimated threat to our lives, to our economy, and the threat is here. It's not going to get any better. The question is, can it get worse? We can stop it from getting worse. That's what he said. That's what we have to do something. The climate change is something. The climate change is something that we have to keep an eye on. And that's just what happened. Whether it's hurricane, the earthquake, to tsunami, the wildfires that comes out, the wildfires it burn up burn the trees in the woods in California. I heard that too. I saw it. In California, we have wildfires. And there are a lot of acres being burned down. The houses are being burned down in California. It's bad out there. For yes, we gotta take a look at it somehow. Now here is when I talk about building back better. I mean, you can't build it what it was before that last storm. You got to build better so that if the storm occurs again, there will be no damage. We got to listen to the scientists and the economists and the national security experts. They all tell us this is cold red, Biden said. He went on to say that U.S. and the rest of the world are in peril. And that's not horrible, Paul. That is a fact. Now, they've been warning us. The extreme weather will get more extreme over the decade. And we're living in it over the decade. And we're living in it in real time now. We're living it in real time now. We can look around the wreckness and the winners and the heartbreak from so many communities to feel it. You can feel it. You can taste it. You can see it. Precious lives lost in Louisiana and in New Jersey and New York. Families living in shelters, subway stations flooded. The crazy information pushed beyond the limits. Lies and livelihoods interrupted once again. We're working closely with governments and mayors and members of Congress and community leaders. That's what Biden added. Louisiana Governor John Bell Edwards said 5 parishes across the state still have more than 95% of customers without power following Hurricane Ida. Those parishes are St. John's, St. Charles, St. James, Tonopah, and Love Fulton, Edwards said at a news conference months ago. As of Tuesday afternoon, around 435,000 customers across the state, including homes and businesses, remain without power, down from 1.1 million in Maryland following the storm. FEMA Radios Director Tony Robinson, in a briefing saying the agency has issued $175 million in variable relief and is housing about 25,000 displaced survivors from 8,800 households in hotels through the Transport Shelter Program. The state currently has 3,180 people in the 23 shelters across the state, including local shelters, Red Cross shelters, and the state-operated shelters. According to the Louisiana Department of Children and Family Service Secretary Margaret Gamma Walters. So this is happening, folks. This is happening, and it's concerned. Our lives have been lost. I mean, it's sad out there when people lose their homes, but you just survived the storm. When people had no power, you just survived the storm. You may lose power, but you just survived the storm. You may lose your homes. You may lose your home, but you just survived the storm. You almost lost your life after the aftermath of the Hurricane Ida. And what has happened so far? That's why you lose everything, but you're going to build back up. You're going to build the homes back up. But it will take weeks and weeks to get everything cleaned up till it's getting back to normal. And this is all I have to say on this, my show. I'm Joseph Crudup. I will see you tomorrow. Until then, take care.